What if the way you touch yourself after 60 is quietly damaging your erection, your penis sensitivity, and your ability to enjoy sex, even if it used to feel completely normal for decades? It is a question most older men never ask out loud, yet it shapes their confidence more than they admit. I am Dr. Emilly Collins, and before we go any deeper, I want you to consider something uncomfortable but liberating. What if the problem is not masturbation itself, but the technique you have been repeating for 30, 40, or even 50 years without ever adjusting to the natural changes in your aging body? Because here is what I see in my clinic every week. Men over 60 struggling with weaker erections, muted sensations, slower arousal, or difficulty reaching climax think their body is failing them. But the truth is far more hopeful. Your body is not shutting down. It is adapting. And when you use the same intense grip, the same fast rhythm, the same friction-heavy routine that worked in your 20s, you accidentally overload tissues that are now thinner, more delicate, and less responsive. Over time, this creates micro-irritation, nerve fatigue, reduced blood flow, and a conditioned response that disconnects your mind from your sexual pleasure. So let me ask you this directly. Have you ever noticed that your penis feels different after years of doing things the same way? Maybe the erection takes longer to rise, maybe sensitivity feels dull, or maybe sex with a partner feels less stimulating than masturbation. These are not signs of failure. They are signs that your technique no longer matches your biology. And once you understand that, everything changes. You stop blaming age, and you start reclaiming control. You have no idea how many older men realize only after a single conversation that the routine they trusted for decades became the very habit limiting their sexual vitality. And the moment they adjust their approach, circulation improves, arousal becomes smoother. And pleasure becomes something they feel instead of something they chase. You have probably felt this yourself but never connected the dots. And before we move on, let me ask something essential. Have you ever experienced any of these changes personally? You can tell me in the comments because your experience matters. And if this introduction is opening your eyes, give this video a like and make sure you are subscribed so you do not miss what comes next. Understanding this content is the first step toward protecting your erection, your confidence, and your long-term sexual health, and what you will discover next may genuinely surprise you as we continue deeper into this transformation. As we continue, you need to understand something most men are never taught. After 60, your body is still capable of strong erections, satisfying sex, and deep pleasure, but it no longer responds like it did decades ago. The hormonal landscape shifts gradually, not dramatically, and that subtle decline changes how your brain and penis communicate. Testosterone becomes less spontaneous, meaning desire no longer appears out of nowhere. Blood flow becomes slower because the tiny arteries that feed your penis lose some elasticity. And nerve sensitivity decreases, making stimulation feel different, softer, or delayed, even when your mind still wants the same intensity as before. None of this means dysfunction. It means adaptation. Yet most older men try to force their body to perform using the habits of their youth, which only widens the gap between what the penis needs and what the mind insists on repeating. Think about what happens when you use the same pressure and speed you used at 25. The penis at 60 has thinner skin, more fragile capillaries, and a more sensitive neurovascular structure. Fast, repetitive friction overwhelms the nerves instead of activating them. A tight grip restricts blood flow instead of encouraging it. And the brain, accustomed to decades of predictable patterns, gets stuck in an overtrained loop where only that intense stimulation produces arousal. That is how many men accidentally train their penis to respond only to their hand, not to a partner. They do not realize that what feels familiar can also be what limits their sexual vitality. Another change that catches many men off guard is the internal pacing of arousal. Younger bodies build stimulation quickly. Older bodies build it gradually, requiring slower engagement, deeper breathing, and gentler touch to awaken the erectile tissue fully. When you rush, you interrupt the natural rise of blood flow. When you grip too hard, you compress the vessels that need to expand. When you force climax, you create tension that blocks the very response you are trying to achieve. This is why so many men say, "It used to work instantly, now it takes forever." The truth is that your body is still responding, it simply needs a different approach. These shifts are not failures. They are signals. Signals that the same old routine no longer supports your biology. Signals that your penis is asking for new rhythms, new sensations, and new techniques that match the reality of your current physiology. And once you start listening to these signals instead of ignoring them, your erections grow stronger, your sensitivity returns layer by layer, and your relationship with pleasure becomes deeper, calmer, and far more connected than the rushed patterns you may have relied on for decades. As you begin to understand how your body changes with age, the next step is recognizing the silent mistakes most older men make during masturbation without realizing how deeply those habits affect their erection, sensitivity, and overall sexual performance. These mistakes are not dramatic or obvious. They are small patterns repeated thousands of times over decades, shaping how the brain, nerves, and penis respond to stimulation. The first and most common mistake is relying on excessive friction. When you are young, the skin of the penis is thicker and more resilient, and strong friction may feel exciting. But after 60, the tissue becomes thinner, the capillaries more delicate, and the nerve endings more easily fatigued. What once felt pleasurable can now create micro-irritation, reducing sensitivity over time and conditioning your body to need stronger and stronger stimulation to feel anything. Another mistake is using a grip that is too tight. Many men do this unconsciously, believing it makes arousal faster. But a tight grip compresses the blood vessels that are trying to fill the erectile tissue, limiting the very blood flow you depend on for a firm erection. It also trains the penis to respond only to a pressure that no partner can naturally replicate, creating a gap between solo pleasure and partnered intimacy. Over years, this conditioning becomes so strong that men say, "I can get hard alone, but not with someone else," without realizing the cause is the technique, not their body. Rushing is another silent enemy. Many older men still use the rapid, goal-driven rhythm they developed in their 20s, trying to reach climax as fast as possible. But aging nerves process stimulation more slowly. When the movement is too fast, the brain cannot synchronize with the sensation, causing arousal to fade or feel unpredictable. Slow, rhythmic, intentional touch actually activates more nerve pathways, but rushing forces your system into a stress response that fights against arousal instead of supporting it. Then there is the absence of lubrication, a mistake nearly every older man makes. Natural lubrication decreases with age, and dry friction irritates the skin, desensitizes the nerve endings, and can even cause slight inflammation that lingers for days. Lubrication is not an accessory, it is a protective tool that preserves sensitivity, comfort, and long-term erectile function. Posture plays a role as well. Many older men masturbate sitting upright in a tight or hunched position, unknowingly compressing the pelvic nerves that control sensation and erection quality. Over time, this creates numbness or inconsistent responses that men blame on age rather than biomechanics. And finally, repetition without variation becomes its own trap. When the brain receives the exact same stimulus in the exact same pattern for decades, it stops reacting to novelty. That predictability can make partnered intimacy feel less stimulating, not because the partner is lacking, but because the nervous system has adapted to a single routine. These mistakes are not signs of weakness, they are habits formed long before your body changed. Once you see them clearly, you can begin replacing them with techniques that match your physiology now, allowing your penis, nerves, and blood flow to respond in a healthier, more natural way. As these silent habits accumulate over the years, many older men begin to feel changes that seem mysterious or discouraging, even though the root cause is far more mechanical and biological than emotional. What most men do not realize is that the way they masturbate shapes not only how their penis responds, but also how their brain interprets sexual stimulation. When technique and physiology fall out of alignment, the entire sexual system becomes confused. Erections may still appear, but they feel weaker, less reliable, or easily disrupted. Sensitivity may still exist, but it feels muted or inconsistent. And arousal may still rise, but it takes longer, fades faster, or struggles to shift into full pleasure. None of these sensations mean that something is wrong with you. They mean the patterns you built decades ago are no longer communicating with the version of your body that exists today. The emotional impact often goes unnoticed at first. A man may tell himself he is just tired, stressed, or distracted. But over time, repeated difficulty can erode confidence quietly, creating hesitation during intimacy or making him worry that his body is failing. Many men begin avoiding sex not because they lost desire but because they fear disappointment or unpredictability. This emotional withdrawal then feeds back into the physical response, as anxiety increases cortisol and decreases the nitric oxide needed for blood flow in the penis. What began as a technical mismatch turns into a system-wide loop affecting erection quality, desire, and overall sexual performance. The physical component is equally important. When overstimulation conditions the penis to respond only to a very specific type of friction or pressure, the nervous system becomes selective. Instead of responding to a range of sensations, it begins reacting only to the strongest, fastest, or most predictable signals. That conditioning affects partnered intimacy as well. Many men report that intercourse feels less stimulating or that they struggle to stay engaged mentally. Yet the issue is not incompatibility with a partner, it is the narrow sensory pathway the body has been trained into through years of repetitive solo stimulation. Circulation also plays a significant role. As men age, blood flow naturally becomes more delicate. When masturbation habits compress vessels or interrupt the gradual rise of arousal, the penile tissues receive inconsistent oxygenation. Over years, this can lead to subtle changes in elasticity, making erections feel less full or more vulnerable to fading. None of this is permanent, but it does explain why. Older men often say that arousal feels unpredictable or that their penis does not behave the same way it once did. Psychologically, older men often assume these changes are signs of aging that cannot be reversed. But what truly changes everything is understanding that the body is simply adapting to signals you may not have realized you were sending. Once you become aware of how your technique influences blood flow, nerve response, and arousal pathways, you begin to see your sexual system less as something declining and more as something waiting to be retrained. And that shift alone opens the door to restoring sensitivity, improving erection quality, and rebuilding confidence layer by layer, as the next part will show in even deeper detail. Once you recognize how old habits silently reshape your erections, sensitivity, and sexual response, the next step is learning how to adjust your technique in a way that actually supports your body instead of working against it. Many men are surprised to discover that they can restore stronger erections and deeper pleasure simply by aligning their stimulation with how an aging penis, aging nerves, and aging blood vessels now function. The most important shift is slowing down the entire process. Your body no longer responds well to fast, repetitive strokes because aging nerves need more time to register sensation. When you slow the rhythm, your brain has a chance to re-engage with the sensory signals coming from your penis. That slower pacing increases blood flow naturally, encouraging the erectile tissue to fill completely rather than partially. At the same time, reducing pressure is essential. A gentler grip allows the arteries to open rather than compressing them. Think of it as creating space for circulation. When you stop squeezing tightly, blood can move freely into the cavernous tissue, supporting firmness and stamina. This approach also awakens nerve endings that may have been dulled by decades of intense friction. Many older men are shocked by how much more sensation returns once they stop forcing stimulation and start allowing it. Lubrication becomes an equally critical part of this new method. Aging skin has less natural moisture, and dry friction can irritate the surface tissue, making the penis feel numb or fatigued afterward. A small amount of water-based lubricant transforms the experience by reducing resistance, protecting nerve endings, and enhancing the smoothness of each stroke. That smoother glide allows your body to relax into arousal rather than bracing against irritation. As relaxation increases, blood flow improves, and the penis becomes more responsive. Breathing plays a larger role than most men realize. When you hold your breath or tense your body, your pelvic floor tightens, restricting circulation to the penis. Slow, steady breathing in through the nose and out through the mouth signals your nervous system to shift into a parasympathetic state, the state required for erections. That calm internal environment allows your penis to respond to touch with more consistency and fullness. Pairing deep breaths with gentle movement trains your body to feel safe, which is fundamental for strong sexual response at any age. Changing positions can also make a significant difference. Instead of sitting upright, which compresses pelvic nerves, try lying back with your legs slightly open or reclining comfortably. This reduces nerve pressure, improves blood flow, and prevents the subtle numbness many older men experience without understanding why. A more open posture supports the natural expansion of erectile tissue and enhances the overall sensory experience. Finally, variation is key. Introducing slight changes in rhythm, pressure, and angle retrains the brain to respond to a wider range of sensations. This flexibility makes partnered intimacy feel more stimulating because your nervous system is no longer conditioned to expect only one specific pattern. Each new sensation becomes an invitation for the body to reawaken, increasing sensitivity gradually and allowing erections to build with more stability. Adjusting your technique in these ways is not about trying to mimic how things felt decades ago. It is about working with your current physiology, discovering new paths to pleasure that respect the realities of an aging body. When you shift from a performance mindset to an exploratory one, your penis, nerves, and blood flow begin to respond with surprising strength and clarity, preparing you for the next level of transformation as this journey continues. As you begin applying healthier techniques that support your erection, sensitivity, and overall sexual performance, it becomes easier to notice patterns in your body that were previously hidden by forceful or rushed stimulation. And this is where many older men start to recognize important warning signs that their method of masturbation may be revealing deeper issues with their sexual health. These signs are subtle at first, often dismissed as simple fatigue or age-related changes, but they provide valuable information about how your nerves, blood vessels, and hormonal pathways are functioning. One of the earliest signs is a sudden drop in sensitivity, where the penis feels less responsive even with gentle, deliberate touch. This usually means that the nerve endings have been overstimulated for years and are now struggling to recover between sessions. When this reduced sensitivity becomes persistent, it can indicate mild nerve compression or early neuropathy, especially if accompanied by tingling or a pins and needles sensation. Another important signal is difficulty maintaining an erection even during solo stimulation. Many men assume this is purely psychological, but more often it reflects circulatory changes. If the erection rises and then fades despite consistent stimulation, it suggests that the blood is entering the penis but not staying trapped in the erectile chambers. This can happen when pelvic tension, vascular stiffness, or long-term overstimulation interferes with the natural mechanism that keeps blood inside the penis. When this becomes a recurring pattern, it may reveal early vascular decline or reduced elasticity in the penile tissue, conditions that benefit greatly from lifestyle adjustments when caught early. Pain or discomfort is another indicator men must take seriously. A burning sensation, soreness after stimulation, or pain near the base of the penis can signal inflammation or strain in the connective tissues. These tissues naturally become more delicate with age, and repetitive friction can create microdamage that takes longer to heal. Persistent discomfort often points to overuse of intense pressure or an unhealthy technique that has been repeated for years without awareness. This kind of irritation affects blood flow and can gradually weaken erection quality if not addressed. Some men also experience delayed arousal or difficulty initiating the erectile response, even when their mind feels ready. This mismatch between desire and physical reaction is often tied to hormonal fluctuations, reduced nitric oxide production, or nervous system fatigue. When the brain struggles to send strong signals to the penis, the result is a slow or incomplete buildup of blood flow. Recognizing this pattern helps differentiate normal aging from early signs of hormonal imbalance or circulation problems that may be improved through targeted changes. A more subtle warning sign is when the penis becomes dependent on one specific type of stimulation to become aroused. This sensory conditioning is one of the most common long-term effects of repetitive masturbation habits. When your body responds only to a narrow range of sensations, it becomes less adaptable during partnered intimacy, creating frustration or confusion. This rigidity in response often reveals how deeply the nervous system has been shaped by years of predictable stimulation. These signs do not appear to punish you, they appear to inform you. They are the body's way of showing where the imbalance is occurring and how long-standing routines have shaped your sexual response. By learning to observe these changes without fear, you place yourself in a stronger position to restore sensitivity, blood flow, and performance, allowing your body to move forward rather than feeling stuck in patterns that no longer serve your sexual vitality. As you begin understanding these signals and adjusting your technique, something deeper starts to shift inside you. Many older men describe it as a quiet return of confidence, a sense that their body is no longer an unpredictable opponent but something they can work with again. When you stop treating masturbation as a mechanical routine and start treating it as a form of communication with your own physiology, your erection becomes more responsive, your sensitivity becomes clearer, and your sexual energy feels less pressured and more natural. This transformation does not happen suddenly. It happens as your mind and body relearn to trust each other. The more you align your touch, your breathing, and your pacing with the realities of your current biology, the easier it becomes for your penis to respond with strength and consistency. Men who make these changes often say they feel younger not because their age changed but because the friction between their expectations and their body finally disappeared. They stop chasing stimulation and start experiencing it. Erections that once felt fragile begin to stabilize. Sensations that felt distant begin returning. And emotional tension that quietly built up over the years starts to dissolve as the body stops trying to fight against old habits. This is what a healthy relationship with your sexual self looks like after 60. It is not about forcing performance. It is about reclaiming control with awareness rather than pressure. When you follow this path, you also begin noticing how pleasure can become more grounded and present than it ever was in youth. Younger men often rush through stimulation, never taking time to explore what their body is actually telling them. Older men, on the other hand, have the opportunity to experience sex and masturbation with a depth that only maturity brings. With slower pacing and healthier technique, you awaken layers of nerve response that fast friction muted for years. You rediscover how arousal builds gradually, how blood flow strengthens with intention, and how the mind becomes fully engaged when the body feels safe instead of rushed. In this stage of life, masturbation can shift from something automatic to something restorative. It can support erection health rather than challenge it. It can enhance confidence rather than weaken it. And it can help you reconnect with your own vitality rather than reminding you of limitations. This is why understanding your sexual biology after 60 is not optional. It is the foundation for maintaining performance, pleasure, and emotional well-being in a phase of life where many men assume decline is unavoidable. It is not. The body responds incredibly well when you give it what it needs instead of forcing what it cannot sustain. And now that you have reached this point, if this journey is resonating with you, let this moment be an invitation. If the value in this video helped you understand your body with more clarity, go ahead and subscribe, so you can continue receiving guidance that genuinely supports your sexual health. Leave a comment saying this message was for me so I know you made it to the end and so your voice becomes part of this conversation. And if this content brought you insight, give it a like to strengthen this community. There is another video right here that continues this same path with the depth your body deserves, so click and keep moving forward with me.